This is another audio transcript from StopSevereStomachPain.com. The name of the article being read today is Severe Stomach Pain Can Be Frightening. Start of audio transcript. Most people experience severe stomach pain one time or another during their lifetime. It can be frightening, but most of the time it passes and is soon forgotten. Children often get stomach aches from overeating or from a dietary food change. On the other hand, stomach pain can be serious, so it's a good idea to get it checked out if it continues. It is possible to have a very serious condition despite minimal pain. Viral gastroenteritis, one of the most common forms of abdominal pain, also known as the stomach flu, causes a lot of discomfort and can last for several days. Usually accompanied by diarrhea, the sufferer may or may not get relief after a bowel movement. There also may or may not be a low-grade fever. If the condition lasts longer than 3 days, it's a good idea to check with a doctor. Appendicitis is a common cause of severe stomach pain. In the early stages, there may be only a slight amount of pain. Chills, vomiting, diarrhea, and belly pain are often common, and it is important to see a physician as soon as possible. The appendix can rupture, and that can be very dangerous. Constipation can also cause severe stomach pain. Young children are not always aware that they are constipated and have a hard time going to the bathroom. Make sure they are drinking plenty of liquids. Always ask a doctor before giving a laxative for someone under 5. Food allergies can cause stomach pain, and many people are baffled for years as to why they feel this discomfort. Once the cause is discovered, they can change the foods they eat, and the pain will usually subside. The stomach pain could also come from other problems in the body. A heart attack, pneumonia, or a urinary tract infection can cause severe stomach pain. It's a good idea to take small sips of clear liquid to see if the pain subsides and stay away from food for at least 2 hours. If the pain continues, it's important to call a doctor. They might suggest going to the emergency room for an abdominal ultrasound and blood tests. It is usually just precautionary, but it is always important to make sure that nothing serious is going on. And if severe stomach pain continues to be a problem, it's a good idea to limit greasy foods. Drink several glasses of water every day and limit soft drinks. Stay away from foods that cause gas and eat several small meals a day. Severe stomach pain is not something that should go on without reason for longer than 7 days. Never put off seeking help, and if a fever develops or vomiting continues for longer than 3 days, medical help is really needed. Remember, most of the time severe stomach pain will pass and is usually nothing to worry about. End of transcription.